At Bolton Hospice, this memorial tree tells of the people whose precious moments were spent here. Like every hospice, they're used to goodbyes, but so rarely to one of their own. Jill Oakes was a senior nurse here for 24 years. She died last Thursday after contracting coronavirus. She was 53.
It touches you that much harder because she had given her all to working at the hospice, and you feel as though you've lost a limb. It's been very hard to keep coming into work, but you come into work knowing that Jill's spirit will always be here.
20% of the hospice staff here have contracted COVID-19. They have cared for coronavirus patients here and at home, but they're doing so without a regular and guaranteed supply of personal protective equipment.
When this box is empty, we have no more gowns.
I haven't been able to get a consistent supply at all for 2 months. And currently, we will run out of gowns on Friday. But what do I tell my staff on Friday? What do I do on Friday when I have no gowns and I have a COVID positive patient?
Last week, we revealed that unlike hospitals and care homes, hospices in England do not have access to government supplies of PPE, triggering widespread shortages. The government said it was being addressed urgently, but a week on, the problem persists. When can they expect a regular supply?
Well, we are improving the supplies of PPE. There's a global shortage, which is a big challenge, and hospices are part of that plan. Obviously, making sure that people get the right PPE is absolutely critical.
But stocks remain critically low, even for the biggest providers of end-of-life care. Marie Curie has 9 UK hospices. After weeks of lobbying, they have just got access to NHS supplies, but they still can't get what they need.
Since last week, we haven't received any face masks. It's unlikely that we'll get them this week as well. We never know what the next week's going to bring. We don't know what the next day is going to bring. And obviously, we're very concerned about having to cancel any shifts, any visits to patients and families. We look after people who are dying.
This is what we're wearing at the moment.
It means nurses like Sarah at Bolton Hospice must use their stock sparingly, not knowing when the next supply will come, but knowing all too well the dangers of the job at hand. Daniel Hewitt, News at 10, Bolton.